important is the branches coming off the aorta. In the previous practical, we saw the first branches coming off the aorta as the coronary vessels here, the right and left coronary arteries, but we're more interested in these branches coming off the aortic arch. Okay, if we look, let me remove our superior vena cava for a second. Turn it around. Oh, it doesn't want to remove. There we go. Move that to the side. We can see here that there are three branches coming off the aortic arch. The first is going towards the right. It's very thick, right brachiocephalic artery. This artery will have a branching going towards the right arm and up the right side of the neck. So that's going to be our right common carotid here, and this right subclavian, which is hard to see, but it actually branches towards the arm. Okay. The other two branches, left common carotid and left subclavian. And again, the left common carotid goes up the neck, and the left subclavian will be deep down, and it will run under the clavicle towards the left arm. Okay. We could see also the venous return from the head and neck. We can see it very well here. We have our jugular veins coming down, and coming from each of our arms, our right subclavian vein and our left subclavian vein. The jugular vein and the subclavian vein come together to form the brachiocephalic vein on the left and brachiocephalic vein on the right. These two brachiocephalic veins come together to form the superior vena cava, which will bring blood directly into the right atrium. So here, on our venous return, we can see again, right subclavian, right jugular, to the right brachiocephalic vein, left jugular, left subclavian, to the left brachiocephalic vein, to the superior vena cava, to the heart. Okay? Note there's only one brachiocephalic artery going to the right, but there are two brachiocephalic veins. Okay? Another two structures, we do have our pulmonary trunk making our right and left pulmonary arteries to the lungs. Remember, when you do look at the lungs, we can see our pulmonary veins are going to be red and the pulmonary arteries will be blue. Just don't forget that there is that cross of color there. The next thing we need to look at are the descending abdominal aorta. Oops, sorry about that. What was that? 10. I'm not sure where that went. Okay, so we have our descending abdominal aorta and all the branches coming off of it, and then venous return to the heart is going to be through the inferior vena cava. Okay. Now, our branches off our abdominal aorta, difficult to see some of them here. They're truncated, they've been cut off. But we can see some of those branches clearly on other models. So I'm going to start by looking at our circulatory tree here. You actually should probably do the whole circulatory tree.
Works for me.
From beginning to end. Yeah.
Nope.
Okay. So we can see our cerebral circulation, blood coming up the aorta, the aortic arch here. And I'm just going to show you the back of the aorta so you can see the three branches. Again, this is going to be the right and this is going to be the left. So we have our right brachiocephalic artery going to the right common carotid and the right subclavian. Here is the left common carotid, and here is the left subclavian artery. Now the common carotids will go all the way up and see how they branch into an internal and an external carotid. The internal carotid will continue upward, and it will actually become the side walls of our circle of Willis. We should go like that. And our side walls of our circle of Willis, let me see if I can a little bit here. Side walls of the circle of Willis become the middle cerebral. But really, you know, it gets very complicated up here. So here we have our circle of Willis we can see, and we can see our basilar artery right there. You see the basilar artery?
Mm-hmm.
Okay. I
hope we see it.
As long as we,
that's all we see on the practical.
Yes. Right. Okay. Then we have our descending abdominal aorta here. We can actually see some of the branches coming off the descending abdominal. From the posterior view, we can see the renal arteries going to the kidneys here. You see those very well. And we can see how when the aorta ends, it branches into the left, right and left common iliac, and then the internal and external iliac arteries. When we go to the anterior here, coming off the descending abdominal aorta, the very first branching off of it is this small little piece right there. That's the celiac trunk.
Where are you?
Under the liver.
Under the liver.
Under the liver. Okay. So it is first branching off under the liver, celiac trunk right there. And only goes for a tiny bit. And then you can see one branch goes to the spleen. Another branch goes to the liver. Branch comes around to the liver, and the third branch it goes to the stomach. You know, the stomach. Remember, this is a gastric. So splenic, gastric, and hepatic arteries. Okay, and we go down a little more. You can see here this big thick red one. That's going to be our superior mesenteric artery. Right next to it, the superior mesenteric vein. We go down just below that. We have these two little antennae. These are the ovarian testicular or gonadal arteries and veins, right and left. And then just below that, we have another branching, and this is going to be the inferior mesenteric artery and vein. Now, the venous returns is a little strange. We saw the inferior mesenteric vein, superior mesenteric vein. Here is our splenic vein. They all come together in this vein here, which is the hepatic portal vein, and then that goes into the liver. It's not the best model to see that in. We actually see it better in we see it better in another model. So if we come down our descending aorta, again, it branches into a right common iliac artery and a left common iliac artery. That will then branch into an internal iliac and an external iliac on the left, an internal iliac and an external iliac on the right. The external iliac arteries continue down into the legs as the femoral arteries. Behind the knee becomes the popliteal artery, and then will become the anterior tibial and the posterior tibial arteries. Okay. The venous return from the legs, we have our anterior and posterior tibial veins to the popliteal vein, to the femoral vein, and that goes into the external iliac vein, and that joins the internal iliac vein to the common iliac vein. One other vein in the leg is our great saphenous vein. This thing here. Okay. What's great about these models is that very commonly the arteries and veins run together. So if you see an artery and vein together, very commonly they have, one is a vein, one is an artery, and they'll share the same name. Okay. Splenic vein and artery, superior mesenteric vein and artery, inferior mesenteric vein and artery. This is our external iliac artery and vein, femoral artery and vein. So you can see they run together, and for the most part have the same name. For the arm, and we can see coming out of our heart again, in terms of our blood supply to the arms. Let me just turn around to the back so you can see the branches of the aorta again. We have our right subclavian artery right here coming off the brachiocephalic artery. And here's our left subclavian artery coming directly off the aortic arch. The subclavian artery will then, it'll become axillary, then brachial artery, and then as we go down into the hands, we have a radial and an ulnar artery. And of course, it depends where your thumb and your pinky are. These are easier to see, again, on our vascular arm model. The venous return, again, we're going to have a radial and an ulnar vein. Okay, come up to the antecubital area, and then what we have is we actually have something called a median cubital vein, which traverses at an angle across the elbow. And then here we can see our basilic vein and our cephalic vein. Again, these are easier to see on our vascular arm. Okay, so here we have basilic vein. This is our cephalic vein, and our median cubital vein essentially joins the two. Okay. All right. I think that's pretty much it for our vascular.